you all want to know about what this study means and what the outcome is, but you want to hear the other side. You want to hear somebody says, "Oh, what are the challenges here? Does it really is it really accurate? What if we take this other viewpoint?" So the approach that we're decided to take uh, really is going to involve bringing each of the speakers that spoke this morning, but with a challenging question, and was an invitation to those speakers to bring other speakers or potentially other people who are attending the conference into the conversation to try to make it more of an interactive learning experience. So, our first question is really reference to Dr. Kramer's presentation, which is there enough evidence to make physical activity a prescribed intervention for cognitive decline prevention in an aging population? When I raised that question with Art, he said yes, and question answered. So we don't need to have that discussion. Art, can you come up, please, here? I want you to lead this discussion because I know there are people in the audience that think that this probably may not be the right approach, or maybe their insurance don't pay for that. All right, okay. So awesome. And Emily, can you introduce yourself?
Hi, my name's Emily Maley. I am at Kansas State University in kinesiology, and I was a graduate student at University of Illinois who helped out on the exercise intervention side of some of the research that Dr. Kramer presented. So that's why he dragged me up here with him.
Awesome. Have a seat, two of you, and then and I know that there may be an opportunity of other speakers who may not be speaking today, but tomorrow. I know I know that Simon might want to participate in this conversation as well. Simon, you want to come up? I'll let you join us. Come on. Did you eat? Did you already finish eating? All right. All right. Okay. So I asked a question. Give me the answer. Oh, okay.
Thank you. So the question was, should we take exercise seriously as a way to enhance cognition, brain health, and to deal with disorders such as depression, anxiety, even disorders and diseases like Alzheimer's, mild cognitive impairment, and so forth. And I think overall, the evidence suggests, yes, there are small to medium-sized effects. That's not true for every study. There's a study, I guess I hadn't mentioned this before, by a group in Granada. I told you a little bit about the research with kids. One of the slides was a group in Granada. This was not the same group. So there's a group in Granada. We heard about umbrella meta-analyses this morning that did an umbrella meta-analysis and essentially came to the conclusion you're wasting your time if you expect benefits from exercise. This was about 2 years ago. I think it was 2023. It's CIRA, C-I-R-I-A, et al. From the University of Granada. But there are many, many other meta-analyses and even umbrella meta-analyses, and I think I presented some of them, that suggest pretty consistently that there are small to moderate-sized effects. It depends on lots of things. And I think what we don't know enough about are the moderators and mediators, the factors that can amplify and decrease the effects of exercise. I mean, I study brain and cognition, but I have colleagues, Eddie McCauley, for example, that studies self-efficacy and anxiety and so forth, and there are also positive effects there. So I think in general we can say, yeah. And why wouldn't you want to exercise? It decreases hypertension, type 2 diabetes, heart disease, on and on and on. So even if you ignore the cognition and mental health, and I'm not, but even if you ignored it, exercise is certainly going to be good for your overall health. You're up. Here you go.
So my thought, if we look at the abundance of evidence in support of the benefits, is that we need to think about how we can be embedding exercise into more care. So I don't know the makeup of all of the audience, but maybe there's people who are interacting with patients in different um, types of healthcare or community settings. And I think that's where research and practice can go, because we, as Dr. Kramer alluded to in his presentation, have major challenges with exercise adherence and getting people to actually do the behavior consistently. So that is a lot of the research that I do is trying to understand and improve exercise behavior so that people can enjoy these benefits.
Thank you. I mean, I would just pick up on the question, so the word prescribe, and ask how. If that's a reality, how are we going to actually do that? How are we going to take into account the social determinants, the factors in which, the environments in which people live, play, work, and take that potentially out of a clinic, thinking about Francine's work, people that um, there's a great editorial in the British Journal of Sports Medicine that talks about privileging the privileged, and the fact that the people who have access to these interventions are those that, it's not that they don't need it, but they're those that can afford it. So how would this work with a safety net that would capture those that are falling behind? That would be my question.
Bring in the audience now.
We can.
Okay. So agree with us, disagree with us, tell us we're full of shit. I don't know. You know, it's up to you. Okay.
Yeah, two quick hands.
Right there. Yeah, we're full of shit. Right. Would you like?
So I think it's great to be advocating for exercise. And people will exercise if everybody's in a room and you say, everybody get up and do this. But then do you go home and exercise? Do you exercise in real life? I often talk to people. Sometimes I've been invited to talk to elderly people, sometimes to groups of kids. And I don't use the word exercise. Exercise is sounds like work. Exercise, everybody's always advising people to exercise. But another term for it is working out, right? So what I talk about is playing out. And in fact, there is some research that indicates that people who have outdoor passions, that play tennis or go hiking or bicycling because it's fun, this is play for them, they live longer, they're healthier on average than people who supposedly work out. And the primary reason is because they do it. People who jog or who do other things, I'm not against those things, but I'm just saying that the great majority of people, and especially when you're talking about kids, talk about kids are not biologically designed to run around tracks or lift weights or do calisthenics. They're biologically designed to chase one another around and laughing and screaming until their sides are splitting, to scramble up boulders, to do all of these kinds of things. So I guess what I'm saying is I think we would, if our mission is to get more people to physically exercise, we'd be better off not calling it exercise. We'd be better off talking about outdoor play.
I think we had somebody else come on up. Okay. I was going to say, Peter, I think that's a great idea. And for many years, I know kinesiologists and others have been trying to build physical activity into people's day. When I moved from Champaign, Illinois, 9 years ago to Boston, in Champaign, you drive everywhere because the public transport, although it exists, isn't quite as consistent as you'd want it to be to get places when you'd have to get there. I don't think if I use my car once a month in Boston, it's a lot. I walk everywhere. So I think to the extent architects are interested in building cities and even smaller communities that engage us to walk a bit more, whether we even walk to the bus or in Boston, as Peter and I probably do, we walk to the T. I think that's another way to build exercise into our day and fool people into exercise. Go ahead, please.
Wonderful lecture. Um, my name is Walid Najib. I'm a physician in the Milwaukee area for the last 35 years. I deal with all kinds of patients, primary care and specialty care. Um, the thing the question I have that physical activity, fitness training, cognitive training really takes effort, and it's not easy to implement. And when you're young and motivated, you can assume that you can do it. But as you get older, also, it's difficult to sustain it. And some people either they decrease the amount of exercise as they grow older, but some people they stop it completely. My question to you, please, how long the effect of exercise last after you stop exercising? So let's assume initially you exercise very well, you want to get all these benefits, but then you stop for many other reasons. How long is there any study to tell us the effect of that exercise? Will it stop after you stop exercise? So you have to exercise all your life, or it will be sustainable and you can get benefit even if you stop exercise after a while?
That's a great question. I can think about that myself. Like, let's say I've been running for 20, 30 years and I quit running when I'm 40. Would I still benefit from this when I'm 80?
Quick answer, my answer, and then you two can do your answers. I think of it as the no free lunch hypothesis. That is, it doesn't last long if you don't do it. There isn't a lot of evidence that if you exercised, even when you're a young person, young man or a young woman. I was an athlete. I was a professional athlete at one point in my life. In the wrong profession, I was a boxer, a professional boxer. Not good for your brain. But these things don't last forever if you don't do them. I don't think we know how long the effects would last, because there haven't been studies that have gone beyond a few years.
I don't have much added insider knowledge into the evidence base on that, but as I was listening to your question, my thoughts went to how can we support people in continuing to be active, and I think some of the suggestions that were just made about thinking about how we can integrate movement into people's daily lives, as well as framing it as movement or play as opposed to exercise. Play doesn't have to be exclusively for children, and adults maybe don't always think about moving in the same way. But if we can help people find ways to move that they enjoy and fit feasibly into their lives, then that increases the likelihood that they will sustain it over time.
The only thing I agree with everything that's been said. The only thing I can add is Megan Edwards, I think was her name, was a PhD student who about 10 years ago published data looking at inducing sedentary behavior in young college students, which at the time I'm not sure how they got ethics for, because we wouldn't have been able to do that in Australia. But they were able to show that over 1 week of just inducing a sedentary behavior intervention among active college students, levels of depressive symptoms increased over that 1 week. So I think that just aligns with everything that's been said around that this isn't something that's we do it once and then it lasts forever. It's something that we've got to engage in, just like medication, over a long period of time.
I was just thinking there is one other piece of evidence that I had forgotten about, and that is the animal literature. And both Rusty Gage from UCSD and Carl Kottman from UC Irvine have looked at this question with rodents. Rodents don't live as long, so you don't have as long to look. But what they found is when they were looking at neurogenesis, the creation of new neurons in the dentine gyrus of the hippocampus, that exercise produced more neurons and supporting structure, glia, for about 2 weeks. And when then exercise, of course, these animals live only 1 to 2 years. So I don't know if you can scale it up for how long we live, but those were pretty explicit studies and very doable, because the rodents don't live that long.
I think one of the, unless, okay, I'll go ahead. No, Carrie, you go.
I was might add a tiny bit to that. I think it would depend a bit on the health outcome. Like, for example, something like bone density, that tends to peak, I think, in your early 30s. So, lots of physical activity early in your life would cause your bone mineral density to peak higher. So, it would have a longer lasting impact, if you then went on to not be very physically active. But then say, we know from hospitalization studies, patients that are bedbound, have quite dramatic muscle wasting with, every day. So, I think it kind of depends on which health outcome you're interested in. But the general message is you need to keep going to sustain most of the benefits. But I did have a question. It would be really great if we could consider, considering there's really, quite overwhelming evidence that physical activity and exercise is beneficial for mental health. How do we address the gap that, it's not really made its way into practice? I know, here in the US, exercise, I'm pretty sure the clinical guidelines for treatment of depression and anxiety doesn't even kind of consider it a mainstay of treatment. It's kind of considered like alternative, it'd be a nice thing to try, along with some really quite alternative things. In Australia, it is actually considered a frontline treatment, but I don't think, even though the guidelines suggest it should be used as a frontline treatment, it's not in practice. In practice, if someone goes to their doctor with depression and anxiety, they'll tend to get referred for therapy and potentially medication. So, and, there might be a throwaway of, it would be good if you also exercise. Yeah. So, yeah, it would be great to hear your opinions on how do we take this evidence and actually get it into mainstream practice.
I've been doing a little bit of research in this area and trying to collaborate directly with mental health providers in a couple of different ways. But I think sort of at a baseline, developing some training that gives them practical tools to implement, whether it's and you mentioned the word prescription. Some of the work that we've done with therapists, the idea of prescribing has been off-putting in mental health settings because they say like that's not really what we do. But can we give them tools to have conversations with patients or clients that still involve discussions or recommendations to make physical activity sort of part of their treatment plan? But we've also done some work trying to integrate physical activity more directly into treatment through things like walk and talk therapy, where they are exercising during sessions, or physical activity therapy groups where they are doing activities outdoors as part of therapy. So those are some initial thoughts, but I bet Simon has some good ideas on that as well.
I mean, I agree with that. So a couple of things. One, I think we need to reorient these interventions upstream. And what I mean by that is taking them out of the clinic and putting them into community settings where people are and where we can actually reach people. For example, food pantries, the work that Francine's doing. We're doing work with homeless shelters in Australia. How can we embed these sorts of interventions there? Two, the training piece is absolutely critical. We know that psychiatrists, psychologists, mental health professionals have very little exposure to physical activity training. The same with nutrition, their level of dietetics training, the same in medical school. There's a big opportunity there. We need infrastructure, so we need referral pathways. Mental health professionals need to know how to refer to physical activity specialists, and physical activity specialists need to know how to refer back to mental health professionals. And those referral pathways need to be very, very clear and available. Training is another thing. We need to be creating practicum opportunities that generate new knowledge so that we have physical activity specialists that understand unique populations that they might be working with, and opportunities to then provide these services. And finally, I'd say culture change, and we've published a bit on this as well. The culture of mental health services is absolutely critical. And what we mean by that is everyone from the clinical providers through to the receptionists, the security guards, and how they actually conceptualize and feel about these interventions. And if they're seen as an add-on that we only do if we have time and if there's spare resources and if we have a champion who wants to drive it, then it doesn't work. And so we need to spend a lot of time changing the culture of those services and getting the mental health professionals truly on board and understanding what it is that these interventions can do. And building on that, we've got data from Australia, from India, showing that mental health professionals who are more active themselves are far more likely to refer clients and to be engaged in these interventions, which is not a surprise. So I think there's lots of different angles there. And a bit of a plug, but tomorrow that's exactly what I'll be talking about with the recommendations from the most recent Lancet Commission.
Yeah, just one more. I think my colleagues have covered most of it, but something else that might be worth saying is sometimes when you get a call from a reporter at the end of the day and you say, I've done this hundreds or thousands of times over my career, but you should do it another time. That is, we need to provide accurate information on what we know and what we don't know. And in the United States today, it's even more important to do this given the lack of interest in funding scientific evidence for many diseases, as well as healthy behaviors. We can also, I think, as kinesiologists, physiologists, neuroscientists, and psychologists, not just write for our professional journals, but we can write for newspapers. We can write for popular outlets. I've written for Arianna Huffington. I've written for the New York Times. I've written for many outlets. I think we need to get out the most accurate and up-to-date information that we can. And not everybody reads this or everybody sees it, but we can also do it online. So it's another way to try to take what we know and try to point out what we don't know and the research that needs to be done to our citizens.
Thank you. I know there's another question out there. Yeah.
Excuse me. My name is Joe. I run a business. We are, I guess I call us a traveling physical education service. So I'm very much in the play and be wild and have fun with kids kind of a mindset. One of the discussions that I have with people, particularly people that I work closely with, is, are we modeling behavior as adults that is showing kids there's something fun about being a grown-up? Grown-ups can have fun and grown-ups can play. Are we giving them something hopeful to look forward to that is being a grown-up just boring, right? But also on the flip side, knowing about the anterior midcingulate cortex, where if we're doing hard work particularly that isn't fun or enjoyable, that's also very beneficial to our brain. So I guess my question, maybe it's more philosophical in nature, but if we're talking about prescribing movement and exercise in the medical world or whatever for these reasons, where is the line of importance? Where do we draw that line between doing things that are difficult and challenging and partially maybe not enjoyable versus having the fun? So where is the beneficial line there?
Yeah, I agree completely, Joe, that if we can make it fun, people are going to want to do it. But to make things fun, I think we need a toolkit. We need many different activities because I find climbing a big mile-high wall to be fun with or without a rope. Now, not everybody thinks that's fun. I've been doing it most of my life. Not everybody thinks that that's fun. So I think there need to be different activities. Some people prefer team-based activities. Some people prefer individual activities. We've talked a little bit about nature today, and maybe we'll talk more about it. Getting out in nature, most people enjoy, I think, and that's a way to get some physical activity as well as enjoy the birds, enjoy the flora and fauna, and so forth.
Yeah, I agree. I think that there are likely trickle down benefits if we can get adults to be active, that has a positive influence on our kids, or maybe vice versa as well. But there's I think sometimes if you say the word exercise, as we've been alluded to, it gives a very narrow picture in people's head of what they typically think of. So if I'm interacting with research participants or students that I'm teaching, one of the things we try to talk about is broadening the definition of exercise and just letting your kind of your mind think about what's some activities that I just have an immediate positive feeling when I think about that. And if there's other activities that you have an immediate negative feeling, then cross those off your list and do something else. There's no reason we have to be limited in terms of what counts.
So, Davy Van Camfort is a physiotherapist from Belgium who basically, I mean, the contribution he's made to the literature on physical activity and serious mental illness is incredible. But Davy's done a lot of work and published a lot of data on self-determination theory and looking at autonomous motivation and how that relates with exercise and physical activity among people with schizophrenia, bipolar, and also major depression. And consistently, it's a very consistent finding that those that are internally motivated, autonomously motivated, are more likely to adhere to activity over the long term. So it absolutely needs to be the goal of our interventions, is not just externally telling people go and be active. That's not going to work. The question then is how, and how do we build the systems and structures that support people to build that internal motivation and to want to participate. I think that's the challenge.
See if we I think we have one more question.
I'm going to really amplify what you're saying, Dr. Rosenbaum. So I'm a psychologist and work with people in clinical settings. I've also done a lot of health and wellness work. One of the things that I'm struck by, just kind of as an example, when we look at people who've had a major cardiac event, obviously one of the recommendations is that you get physically active. 3 months after that cardiac event, most people are doing much better. At 6 to 9 months, they're almost all of them are back to their previous activity. Psychologically, the reason for that seems to be that we're presenting it as an emergency. And what we do in an emergency is we do what we need to do to rectify the emergency so that we can get back to the way our life was before. At that point, our prescription becomes more of a problem than a benefit. I remember having a conversation with Dr. Craig Becker, who has written a lot about salutogenesis, and he said, we tell people exercise so that you won't get a heart attack, you won't have this disease and that disease, and the person says, I already don't have a heart attack, and I already don't have these diseases, so why would I do these things to make myself uncomfortable? So the question becomes, as you're saying, how do we get this to be an internal locus of control rather than external locus of control? How do we make it so that people exercise or are active because they enjoy it? And one last comment. One of the things we notice is that if you look at a child that's 5 years old, you can't get them not to exercise or move. That's the, even if you're saying move, they're already moving so they don't hear you. By the time we're 30 to 40, we're looking at 25% of the population roughly that is still regularly active. And so what happens between that time and this later time that causes us to stop enjoying that activity? And I don't have answers to that, but those are questions that I have.
It's going to venture. Okay.
I have a thought on the first piece about the heart attack messaging. I absolutely agree that those messages don't resonate with people and don't provide any motivation to want to do the behaviors. So I've done some work with Michelle Seeger, who's a colleague at Michigan, who Across multiple studies, we've seen that the messages that are most strongly linked to exercise adherence over time are the ones that focus on sort of people's immediate well-being. So whether you're a doctor or some sort of health professional who's talking to patients, if we can help them see how if I'm active today, I feel less stressed, I have more energy, it improves my mood, and I see that immediate return on investment as opposed to having to wait 40 years to not have a heart attack, then that increases the autonomous motivation and gets you some of the buy-in where people then view it as something that they want to do as opposed to another chore that they have to do.
I just think the link between enjoyment of childhood physical activity and participation in physical activity as an adult is so critical. I'd be interested, Rebecca. I mean, your talk this morning was absolutely fantastic. I don't know if you have any comments on that. It's not my area of expertise at all, but I think it's so critical. And obviously, the work you're doing around building that enjoyment, I think, is critical. I don't know if I'm sorry to chuck you on the spot, but if you're happy to add anything to that.
That is a great segue into the next conversation that we will have around physical education and physical activity in kids.
Is that I didn't even realize, but sorry. Okay. There we go.
Well, the one comment I'd like to make is that on our foundation website, we took the word exercise out because we realize how threatening that word is, and people see it as, well, I'm out there, I can't be exercising like you do or that. So we focus on physical activity, and I think the challenges that we have in our culture and the challenges that we have in the way physical activity is viewed is that when kids are, like you described, they're very active, but then they get to a point where they have this organized physical activity. We're now competing in soccer or football or all of that. And then it becomes not about the physical activity, it becomes about winning. And I think the challenges that we have is that the orientation of physical activity among children evolved from being play to being playing to win. And if you don't win, then really you either drop the sport or you do something different and you resort to things that are not necessarily activity oriented. So we really have an upstream challenge, and I look forward to hearing your conversation, because my foundation decided to engage in supporting an organization called Fit Kids, because it's bringing organized physical activity into the life of children with the hope that this will be a lifelong journey. It's not competition oriented, it's not about winning, it's about having fun and enjoying it. So I apologize for those who still have questions, but we are moving on to the next dialogue that we have. So thank you, everybody. Thank you, Art. Thank you, Emily. And thank you, Simon.